Everyone, I'm Dr. Francisco, specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is time for part 7, that is diabetes diagnosis. I hope you enjoy it. These talks are part of our efforts on health promotion, focusing on diabetes prevention and early detection, so you can become a healthier version of your previous self. As mentioned before, we have 2 health enhancement and weight management programs, ARIS and Janus. If you are interested, please call this number. Let's start with our talk proper, diabetes diagnosis. Many patients with diabetes, they don't know they have it because they don't have symptoms. That's why diabetes is silently dangerous. Some of them have some symptoms, but they cannot link it to diabetes. Later, they develop weakness, malaise, excessive hunger and thirst, blurred vision, increased urine volume, and loss of weight. And then they go and see the doctor. The doctor performs one or more than these tests, for example, measuring random blood sugar or fasting blood sugar, or measuring the caramelized hemoglobin I mentioned before, the HbA1c, or performing a challenge test with sugar, a sugary drink, to see how high the sugar in the blood will go. Although ambulatory glucose profile is not validated for diagnosis, it can aid in diagnosis. I will mention a little more about this in another talk. So, if the patient has got symptoms of diabetes and the blood sugar is 11.1 millimoles per liter or more, you can diagnose diabetes. If the fasting sugar is 7 millimoles per liter or more, you can diagnose diabetes. Or when the caramelized hemoglobin, the HbA1c, is 6.5% or higher. The oral glucose test, when the value at 2 hours is 11.1 millimoles per liter or more, you also will diagnose diabetes. Let me show you how that test looks. A patient drinks a solution with 75 grams of sugar or glucose, and then the blood sugar is measured in different time points, and if at 2 hours is more than the value I commented before, more than 11.1, the patient is diagnosed with diabetes. If the value is around these numbers, it will be a normal test, and if it is in between, most likely the patient has got prediabetes. This test has to be performed in 2 different occasions, in 2 different days, and when the patient doesn't have any acute illness like infection, because some stress hormones can increase the blood sugar and give a false positive result. And as I mentioned before, the ambulatory glucose profile can aid in the diagnosis. There are other tests that we perform in patients, or other screenings we should do in patients with diabetics to check their well-being. We should measure the protein in urine and the kidney function to be sure they don't have diabetic kidney disease. We can check the heart with an electrocardiogram, or if we find more signs of cardiovascular disease, refer to the cardiologist or do other cardiac tests. An eye doctor to check the back of the eyes, dentist to check the teeth and gum condition, check the blood pressure, the blood lipids, also have their feet checked to be sure there is no injuries, how is the sensation, give them recommendations of feet hygiene, to keep the feet clean, be sure they don't walk barefoot at home. Vaccination, for example, influenza and pneumococcus are important. Monitor the weight loss, and check how is the mood and well-being overall of the patient. As I mentioned in the previous talk, for complications, indeed, diabetes take a big toll on patients. So I hope this talk was useful. Please stay tuned to these videos. Subscribe to our channel. The next talk will be ambulatory sugar monitoring. Take care. Bye-bye.